Okay, we'll call the Health Services Committee meeting to order. They need a approval of the previous minutes. Supervisor Bruno, Supervisor Running second. Any questions? All in favor?
Aye.
Opposed? Okay, privilege of the floor. Anybody have anything they'd like to discuss before we start? Seeing none, we'll move on. We'll start with Office of the Aging, and Administrator Taflin's going to report that for us.
Thank you, Mr. Chairman. The action item is to increase expanded in-home services for the elderly contract with Hamilton County Public Health. It's currently, the contract is $31,500. They want to increase it to $45,000, and they want to continue that for the future. 75% of this funding is funded by the state, and the other remaining funding will be funded by Hamilton County. So no cost to Warren County. It's just to increase their contract for this ISIP program going forward.
Okay, can I have a motion? Supervisor Thomas, Supervisor Wild second. Any questions? All in favor?
Aye.
Opposed? Okay. Pretty much it, isn't it?
Thank you, Mr. Chairman.
See how good he did? Okay, we're gonna go next to veterans, but is she coming?
Hang on.
Wow.
I would just like to commend the health services for this report.
She's coming in after. You can read it all?
Yeah, a lot of it. I mean, I didn't read it. I looked it over. But I was part of health services. So.
It is nice to use that. I mean, it's
Oh,
thorough.
very
It's, yeah.
Okay. Oh, yeah, she's
Yeah.
And I was like, whoa.
on her way. We're health services tonight.
All right, you can tell her I.
I tried to steal your committee to veterans. I like Denise.
Yeah.
Done a wonderful job for us.
Yes.
Ah, here we are. Okay, so we'll do the health services. Can I have approval of the minutes of the previous meeting? Oh, I already did that. Oh, so I'm going back right here. Okay, Janelle, you're on.
Good morning, everyone.
Morning.
So the first resolution request we have is to accept our 2023 annual report. Typically, we don't print them out. We just ask people to see us if they would like a paper copy, but because we have so many new supervisors and it's been a while, we figured it might be helpful if everybody had a copy. So this is a thing we do each year for health services to prepare an annual report to document our programs and trends. This report is also a reflection of the dedicated and amazing efforts of our entire health services staff, which includes our contractors, to ensure that these services are available to promote the health and safety to our community. I want to sincerely thank each and every staff member and contractor for their dedicated efforts.
What?
Do we need approval of the resolution? Or should I just go on to the
Well, we need
second
to
request?
put it onto the floor first. Supervisor Bruno, Supervisor Runyon second. All in favor? Opposed? Okay.
Very well done. Very.
Thank you. Resolution request 2 is to authorize a contract with the State Health Department Special Supplemental Nutrition for Women, Infant, and Children Program. This is AKA WIC. For grant funding in the amount of $2,727,500, which equals out to $545,500 a year for the 5-year grant period of October 1st of 2023 to September 30th of 2028. And also to authorize the chair of the board in a form approved by the county attorney to accept any additional WIC funding, approve any contract amendments, and to enter future New York State Department of Health WIC contracts without further resolution.
Okay, can I have a motion to bring this to the floor? Supervisor Runyon, Supervisor Wild. Any questions? No? Okay, call the question. All in favor?
Aye.
Opposed? Okay,
The next three requests are related to recent resignations within our department. We have two programs, the WIC program and the early intervention, that have been affected. So resolution requests 3 and 4 kind of are buddied up together. So resolution request number 3 is to amend our health services table of organization to reduce the salary of the public health program coordinator, which is a grade 18, step 5, from 66,055.08 to 0, effective August 12th, 2024. We plan to utilize this salary to fund the public health program manager position, which is currently in our table of organization but unfunded. And this is attachment number 3. We're requesting to defund the public health program coordinator position and fund a vacant unfunded public health program manager position, which is a grade 21 position. The WIC coordinator has resigned effective 6/14/2024 due to the difficulty in trying to recruit and trying to keep this program running. We thought it prudent to do some readjusting. The public health program coordinator has been asked to manage the WIC program in addition to other public health programs. We plan to keep unfunded, the unfunded public health program coordinator position in our table of organization, just to be able to promote retention opportunities in the future within our department. This is going to be an overall savings of the WIC and the public health program because we're doing like a 60/40.
okay. Would someone like to make a motion to do 3 and 4 together? Okay, Supervisor Runyon, Supervisor Bruno. Now to bring them to the floor. And we're all set then. Would anybody got any questions?
No.
No. Okay, call the question. All in favor?
Aye.
Opposed? Okay, that carries.
I'm on to number 5. Resolution request number 5 affects our early intervention program. This is to amend our health services table of organization to delete a 10-hour-a-week per diem early intervention service coordinator, grade 18 step entry position, which is 14,377 plus fringe, and it's about 27.65 an hour. And to delete a 30-hour per week part-time early intervention position, which is early intervention service coordinator number 3, which is a grade 18 step 11 position, which is 51,611 plus fringe at a rate of 33.08 an hour. And to create a promotional full-time 40-hour-a-week early intervention service coordinator program, which would be a grade 18 step 11, which is 68,806 plus fringe. And we're asking that this be effective September 1st of 2024. The New York State Health Department's early intervention program is going to be starting a new application in the fall of 2024. And this individual the individual that was in the 10-hour per week position decided to retire in May, so she didn't have to learn the new position and the new application. And the individual in the 30-hour per week position is willing to accept a promotion to make up those 10 hours. It's eventually a better plan to meet the needs of the early intervention program and our families. It's going to allow time to learn the new program and service the families without interruption. The salary cost of this change is an estimated $2,818 plus fringe. The position will also be offset by our children and youth with special health care needs grant funding. 9,372 will go towards that. In addition, it has the breakout for salary is 7,886 and the fringe is 1,486. In addition, New York State reimbursement at 49% is eligible for the service coordination. So I do think, even though there's a little bit of a cost, it'll serve our county better.
Okay, can I have a motion to bring this to the floor? Supervisor Runyon, Supervisor Gilligan.
questions?
Questions?
Oh, sorry, I
That's all
jumped the
right.
gun. I apologize. Fringe is just the standard health insurance package and optional life insurance type stuff that the county offers a full-time
Yeah.
employee.
Could be, yeah.
Is that what fringe means?
Fringe is you definitely with everyone, retirement, social security and Medicare. Some people have health insurance, some people have dental insurance. It just depends where it falls. In this case, the one program covers the health and dental. We budgeted under, we don't split it up. We budgeted under one program. But in most cases, it's at least the minimum retirement, social security and Medicare. When we do grants in most cases.
So when we see fringe on here, it doesn't it doesn't actually mean health insurance every time, just to.
Not every, in this case, not no. Well, you were asking about life insurance and disability, or we don't, that's not part of that. We don't get charged that. We don't get charged life insurance. We don't get charged. I mean, the department doesn't. The employee usually pays for that kind of stuff. But the health, dental, retirement, social security and Medicare are all fringe.
Thank you.
Okay, any other questions? Oh, did you have a?
Thank you, Mr. Chairman. Just to clarify a little bit, so also, when we're budgeting for a position, we always have to include the fringe cost because that goes into the budget too. The employee doesn't get that, but those are the, like, Ton said, you know, the contributions we have to make to things like Medicare and Social Security and retirement benefits. That's a standard package, and then additional health care and things like that is added in. But it's basically, say we're paying someone $50,000. So that goes with that usually is a package of about an additional $15,000 to $20,000 that comes out of the budget.
Thanks. Yeah.
Follow-up question. So what does the county deem full-time? And since we're talking about health insurance and fringe, what do we call a full-time person here?
You're eligible for health insurance at 30 hours.
That
This
answers.
person- This individual was already eligible. for health insurance.
Thank you.
Or 30 hours.
30 hours.
30. Thank you.
Okay, any other questions? All in favor?
Aye.
Opposed? Okay, carries.
Resolution request is to amend our 2024 budget to utilize our New York State Performance Incentive Award funding to purchase health education materials, including an inflatable colon for interactive cancer prevention outreach and education. Health Services was awarded $12,349 to utilize for special projects, and we'll submit a voucher for 100% state aid reimbursement once we utilize the funding.
Okay, motion to bring this to the floor. Supervisor Runyon, Supervisor Bruno, it's right up your alley.
Yeah. Inflatable dolls.
Any, any questions? Kind of threw me for a little loop when I read it too, but that's fine.
Same company.
No? Okay, all in favor?
Aye.
Opposed? Carried.
Resolution request number 7 is to transfer funds in the 2024 budget, and Tom is here to explain.
Attachment number 7 are the transfers of budget. The first one was we had some retention and recruitment that we needed. We got some polos and some rain jackets for our employees that have our logo on there. And we had to transfer some money. So that's the first one for $1,300 to pay for that in one department. The rest of the departments were all able to handle it. The second one is our preschool program that we had to move some money over into our health education. Again, talking about insurance, like you were saying about the budget. Lots of times if you have a vacant position, we might budget for just basic single coverage. Then if someone comes in and gets family coverage later, or someone doesn't take it and then they do take it, we have to adjust the budget accordingly. So in this case, the number 2 was that the employee had taken on more insurance, so I had to move some money to cover that. The third one is, again, talking about the early intervention program, moving money to get us through to the end of the year. I moved salary, and again, just the retirement and the FICA and the Social Security regarding that to get us through to the end of the year. Again, that's a guesstimate. Not knowing what union negotiations are gonna happen or anything, but at least with that, I've moved all that. So the total of this whole page is $13,431 to move monies to cover.
Okay, I have a motion. Supervisor Runyon, second, Supervisor Thomas. Any questions? Okay, all in favor?
Aye.
Opposed? Okay,
The remainder of the items are typical attachments. Our revenues and expenditures are on attachment number 8 and the comparison is 9. Do you want to go over them or does anybody have any questions?
I don't have any questions. Does anyone else on the committee have any questions for her in discussion? No?
All right, and then we have our status of referral attachment, our activities with our emergency response and preparedness, our rabies report that reflects all of our bites and follow-up, and our upcoming clinic. And I also attached a rabies clinic schedule for your towns. And that's all I have.
Okay, any other questions for Janelle? Yes, Supervisor Bruno.
Regarding the rabies vaccination clinics, do you get a good response to that?
We do, especially since the pandemic, when we were unable to have them, or we were creative in trying to do appointment only. Appointments with the dogs out here in the parking lot, where we could, when things kind of opened up, but they've been well attended. We're required to have 4 a year. Historically, we used to have around 12 a year or 22. But I think we are doing 6 ton.
Tough to get those dogs to keep their appointments.
But it's not appointments anymore and we accept anybody and everybody and we encourage people to come, especially people that have a lot of animals. And technically it's a free clinic. We just ask for a donation, but nobody's turned away, nobody's asked or hassled. It's like, oh, yeah, no problem,
Great, I think it's a great question. Thank you.
Okay, well, I'd like to apologize to Janelle. I told her she needed more than 20 minutes and actually she only needed 18, so my apologies to you for that. Motion for adjournment. Supervisor Bruno, Supervisor Wild. Oh, wait, before we do that, anyone from the public have anything that they would like to comment on what we just went over? Okay, now we'll take that motion. Supervisor Bruno, Supervisor Wild, all in favor?
Aye.